So we've got an LGBTQ plus station now. So yeah, here's some of the notes. I mean, we did talk about these in the last session. Here's just a kind of a recap of, you know, these acronyms. What do they stand for? So obviously lesbian, gay, bisexual, transgender, queer, and questioning. That's really the important ones to be aware of. So it's LGBTQ plus. And so the plus would involve all these extra ones at the end. Transsexual is an outdated term, so I wouldn't use that anymore, even if they have, you know, completed their transition. So, you know, historically, transsexual would have been somebody who's kind of gone through that transitional period and has, you know, is now finished. But we don't use that anymore. So let's just stick to transgender, queer and questioning. So they're still used, but then these kind of, because these acronyms too long, so they've just kind of put those as a plus. But yeah, so ally is kind of you know, people who aren't queer, you know, that don't fall into any of these, but you know, they support the LGBTQ plus community. So really, as medical professionals practicing in you know, the UK, we want to really see ourselves as kind of allies to this community. That's the kind of approach that we should have. Intersex is kind of your medical conditions, you know, hermaphroditism and chromosomal conditions like Klinefelter syndrome and Turner syndrome, where there's kind of, they don't fall into a set category in terms of the external and internal genitalia. But yeah, asexual, so they don't have any sexual urges, and pansexual is kind of they don't discriminate between anyone. They just need to be human. So that's the kind of LGBTQ plus, and they do, you know, they do update these every now and then and add extra letters. So they do keep updated. Because it is important to you know, to be aware of and to show, you know, your patients who are members of this community that you are kind of well informed, and that you you know, you're active in keeping engaged and informed about all the latest developments in terms of like legislation and you know, just kind of social attitudes towards these kind of things. So it definitely is a hot topic, in particular transgender. So that's why you know, we have been focusing a lot on the transgender ones lately, because that is definitely a hot topic, and the one where there's been kind of most the most changes in the last few years, because, you know, I think you know, the gay kind of movement, that's kind of been going on for a long time now, but the transgender is kind of more of the recent one now, where, you know, there's been a lot of developments in gender identity clinics. And so and also you see that when you walk across the streets in England, you just see that there are more openly transgender people than there were before. So definitely there is quite a noticeable difference, I would say, and also just it's also reflected in the number of referrals that are going into gender identity clinics. So there's a lot of referrals and huge waiting times for them because there's such high demand. So these are just a few of the kind of expectations of how you would be expected to approach these kind of patients. And an example of pronouns. So it might be worth asking, you know, with transgender patients, you know, what their preferred pronouns are at the beginning. So when you do ask, you know, how you'd like me to address you, that by the way is a question that becomes even more kind of important with these kind of scenarios. Asking how they'd like to be addressed, you know, what name they would like to be used, and what pronouns they use. So really there's three types of pronouns. So feminine pronouns, masculine pronouns, and gender neutral pronouns. So the feminine ones would be her, she, your masculine ones, him, his, and then your gender neutral ones are they, so they and them. They're your kind of gender neutral ones. So some patients who kind of do not identify distinctly into either being male or female, they prefer to kind of use these ones and feel more comfortable using those. So definitely do ask, you know, these trans, if you do get one of these stations, it might be worth asking about their chosen pronouns, and that you would, you know, make a note in the system, and we'll try our best. So if it's in a GP surgery, you know, we'll try our best in the future to address you using those pronouns. So just a quick note on your reminder of the good medical practice guidelines by the GMC, and how these kind of notes become even more relevant when you're when you have a patient who's a member of the LGBTQ plus community. So, you know, important things about discrimination, about putting your personal beliefs to the side, whatever they may be, you know, just saying neutral. And always, you know, never denying access to appropriate treatment if it goes because of your own personal beliefs. So, you know, if you're working in a GP surgery and a patient's come to you with gender dysphoria, and, you know, it'll be, you know, in the guidelines, it suggests that you need to refer them to a gender dysphoria clinic, then you should do that. You shouldn't be a barrier because of your personal beliefs. Yeah, and just one thing about the Gender Recognition Act. So do be careful about disclosing somebody's transgender status. That is, you know, they have a right to keep that confidential, just like any other personal or sensitive information, any other healthcare information. So it's important to yeah, be very cautious with that. You know, even colleagues, you know, I would be cautious about just disclosing somebody's transgender status unless it was, you know, important that you did. So yeah, just this is just a GP presentation. I'll try and try not to give too much information so that you can kind of just deal with it in the consultation within the 8 minutes, just so that we can kind of replicate the exam as much as possible. So GP surgery, so 16-year-old, all they've said is that he's presented with some concerns for the GP surgery. So yeah, talk to the patient and address their concerns. Okay, start now, please.
All right.
Begin.
Hello.
Hiya.
Yeah. Good afternoon. My name is Dr. One of the GP junior doctors in this surgery. Please, may I know your name and your age?
Sure. Yeah, my name is Jensen Button.
Jensen?
And I'm 16 years old. Jensen Button.
Oh, Jensen Button. Is it okay to call you Jensen during the course of this conversation?
Yeah, that's fine. Yeah.
All right, Jensen, you are welcome to our practice. Please, can you tell me why you have come to see us today? I understand you have some concerns.
Yes, doctor. Yeah. So the reason I've come, I mean, I've been thinking about coming to see you for a while. But doctor, the reason I'm here is I want to change my sex. I want to become a boy.
Oh, Jensen, I see. Since when have you been given this thought, Jensen?
To be honest, doctor, it's been as long as I can remember. You know, I've just kind of had these thoughts for as long as I can remember, and I've just kind of suppressed them. But now, I think I've got to a stage where, you know, I have to start talking to somebody about it. So I thought I'd come and see you.
It's all right, Jensen. Even though you are 16 years, we, you know, accord you same confidentiality as we accord all our patients. So it's a good thing you have come to see us today. And I want to assure you that whatever we discuss during the course of this conversation will be between you, myself, and my team alone. Is that okay, Jensen?
Yeah, that's great. Thank you so much, doctor.
All right. So can you tell me more about your concern and why you've not been able to come through with your thoughts?
Sure. Yeah. I mean, so I've, you know, I was born as Lisa. So, you know, that's what you have on your records, Lisa Button. But I do prefer to be called Jensen, just because I just feel really stressed and this anxiety, you know, about kind of just when I look at myself and my body, I just feel like I'm trapped in the wrong body. And you know, as I've gotten older, and you know, I'm 16 now, so I'm kind of noticing the changes in you know, the breast and things like that, and it's really making me more and more uncomfortable. And you know, I just want to stop. You know, my breasts, they just keep growing, and I just don't really feel uncomfortable about it. I've not spoken to any of my family or anyone else about it, really. So one thing I have spoken to is I spoke to one of the advisors from the LGBT Foundation, like a live chat, but apart from that, I've not spoken to anyone.
All right, Jensen, it's okay to feel the way you feel. I understand, you know, how, you know, what you may be going through. And like I told you, we are here to assist you. But have you talked to anyone about this? Your family, your parents? Have you talked to them about this?
No, so I mentioned earlier, sorry, you must have not heard me. I mentioned earlier that, you know, I haven't spoken to my family or friends. The only person I spoke to was an advisor from LGBTQ Foundation, but no one in my personal life, no.
Okay. So, and so what steps have you taken so far?
I've not taken. What do you mean? Sorry. Do you mean medication?
Yeah. Are you taking any medication?
No, I'm not taking any medications. No. Although that is something I would be interested in.
All right. So, Johnson, what your feelings is quite noted, and there are quite a number of persons who feel the same way and who are trying to achieve what you are trying to achieve. So like you mentioned, there are group of persons, there are support groups we can refer you to that can be of assistance to you in resolving what you are planning to do and in getting you through. And we also, in the practice, where there are special clinics, we can also refer you to in the practice. There are special clinics that we can refer you to that can also look into your decision and see how they can help you through. Would that be okay by you?
Yeah, I mean, to be honest, doctor, that's one of the main reasons I've come to see you is, I've heard that they do give, things like puberty blockers and testosterone. There's some things that I would be interested in because I do feel like I am a man and I would like to become a man.
It's all right, Jensen. But again, let me ask you some more questions. Since you've been going through this, have you experienced any form of bully or discrimination from anyone around you?
Yeah, I do get bullied a little bit at school, but nothing that's really upset me. I've got quite thick skin, so yeah, it's not really upset me too much, but nothing major, no.
All right. So, and how is your family and friends supportive of your new decision?
So as I explained earlier, I've not told anybody, and the only person I've spoken to and told about this is just kind of something I've kept to myself. I did speak to an advisor on the LGBTQ Foundation website on their live chat, but I haven't spoken to anybody. Nobody knows about this in my personal life.
It's all right. Presently, who are the people that you live with in the home?
So I live with my stepdad and my mum and my 2 brothers.
It's all right. It will be important you carry them along about your new thinking, and it's good to assure you that you should not be alone in this, and you should be encouraged. Don't feel discriminated against, and if you have any challenge, you can always come down to the clinic and discuss with us. Is that okay, Jensen?
Oh, bless you, doctor. Yeah, that's so nice of you. Thank you so much.
It's all right. So I'll be referring you to the clinic, the special clinic that handle this issue, and they will be counseling you and be giving you some medication and offer you some advice and treatment. Would that be okay?
Oh, okay. Yeah, that sounds good. Yeah.
Yeah, I will also share with you information.
Move on to the next station.
Do you want to, just finish the last couple of sentences that you were going to say?
Yes, I said I will share with you leaflets on information on, support groups and, other things you may want to know about your treatment and how to go about it. Is that okay?
Yeah, that would be great. Thank you so much, doctor.
It's all right. You have any other question or concern?
No, thank you.
It's all right. Thank you.
Thanks a lot. Bye-bye. Okay, nice. I really liked your kind of, especially the opening kind of few sentences after I'd explained kind of my problem. Some really nice empathetic responses. You emphasize that this is kind of a safe and confidential place. I really liked that. I thought that was really nice at the beginning. Yeah, so and you talked about the support groups. Yeah, I don't know if it's audio issues or if you can't hear me properly because of the audio, but I did mention that I haven't told anyone in my personal life quite early on, and that the only person I've spoken to was online talking to like one of the foundations, the LGBT Foundation. So I think just be careful about because if you ask a question where the patient's already given that information, it can make it look like you're not listening to them. So yeah, just be careful about that. But yeah, like
I noticed that too. I got confused when he made a lot of statements. It wasn't quite audible, and because
right.
he was, you were talking, you were stating a lot of points, so I couldn't bring you back. I just wanted to see if I could make out what you said, but I didn't quite get everything you said, so I had to ask the question again.
Right. Okay. So if you did miss information, I think it might be worth saying I didn't catch all of that. Yeah, you know what I mean, like so that you've already kind of acknowledged that you didn't actually hear all of that, so you may end up repeating a question that they've already kind of volunteered that information. So that might be a good strategy if, in the future, if you're on a consultation and you kind of lost track or something, or you're not sure if someone mentioned something or not, then just give that kind of warning before you ask it, just to make sure, so it doesn't end up looking like you didn't listen. But yeah, like really nice, empathy at the beginning. So kind of like the ease. I think, like with these kind of sensitive topics, once you've done your open question and the patient talks and is vented and got everything off their chest at the beginning for the first 30 seconds or minute or so, it's nice to do the Eve protocol and to reassure. And so I think, like I can see that, or I can appreciate that it's very difficult to talk about this. So thank you so much for sharing. And I'm really sorry that, you've been going through such a difficult time. This is a really safe and confidential place. So I'm here just to help you, okay? So that's like Eve protocol, and you've reassured them as well by telling them that it's a safe and confidential place and that you're here just to help. That's the way I like to approach these kind of sensitive ones. So obviously in this one, because this patient's 16 years old, he's going to be referred to a separate clinic for those who are less than 17, the Gender Identity Development Service, or GIDS, where it's a bit different. So they're a bit more cautious about prescribing. So when you say things like, they're going to give you medication, I would be a bit more cautious about that, because they probably won't at this early stage. It will just be more kind of the psychological aspect, psychological support and counselling is usually the main focus, and an assessment. And then once they turn 17, then they will be referred to the Gender Dysphoria clinic, where they are, more open, although they're still cautious, but they will be more open to, these kind of pharmacological and surgical treatments.
Yeah.
But for the under 17, the emphasis is more on an assessment, which is like several months by various different healthcare professionals, and psychological kind of counselling is kind of the mainstay of how they manage those kind of patients at that age. But yeah, so obviously normal GRIPS introduction. If the transgender state is known, you might want to to ask them to confirm that, specifically state the birth name if you already know that they're transgender. And then asking them, how would you like me to address you, or which pronouns would you prefer? And I'll make a note in our records, and we'll do our best to use them. That's just a suggestion of kind of if it's already stated in the task that you've already been made aware that they're transgender, then you might want to make a few adjustments, for your introduction. But then otherwise, after you ask your open question, Eve protocols is nice. So I can see and appreciate that this has been a very difficult thing to talk about. Thank you so much for sharing. So definitely, I think it's nice, and Dr. did this is to thank them for showing the courage to talk about this with you. So giving them some positive reinforcement for all that, and just kind of an empathetic response. So I'm really sorry that you've been having such a difficult time. And then I do like to reassure that, like you did, Dr. very nicely, emphasize that this is a safe and confidential place. Just remind them about that, just in case that they're worried you're going to start, calling their parents or something, because they are only 16. So this is a confidential space. And then the specific questions for the transgender. So the patient's kind of giving you, and I like how, Doctor, I've noticed you do this a lot, because you say, tell me more at the beginning. You often do that at the beginning. So the patient will volunteer all the kind of important information, and then you can kind of fill in the gaps afterwards with your closed questions here. So that was really nice. I like that approach. I think that's really useful for, especially for, time management. So how would you describe your gender identity? Since how long? What name and pronouns do you prefer? We already talked about that. So assess their self-perception. So what their biological sex was, you can ask them that at birth. Obviously, you already know that. But just to assess them. And how do you feel about your body? So breasts, genitals, body hair might be things you want to ask about. One, or how long have you felt about this might be another one. Have you shared this with anyone? So get an idea about who they've told about. I think there are some important questions, and then kind of assess kind of what they've gone what changes or adjustments they've started to make, if any. So have they been referred to in a clinic? Have they thought about changing their gender, and have they actually made any steps towards doing that? So hormonal stuff, and if they have had hormonal stuff, establish if, because a lot of these patients, they are so keen to take these medications. They often buy them like themselves online or underground. They'll buy the hormone therapies themselves, and that's even if they've got a prescription. They might have a prescription from their they've been getting from their gender dysphoria clinic, but then they also top up on that extra stuff that they buy online. So it might be worth to asking them about that if they are taking something. And then surgeries and stuff. yeah, and then so sexually active. So it might be good to ask about kind of get an idea about the relationship. Are they sexually active? Are they in a relationship? Is their partner male or female? So that's something I would include in my kind of closed questions here section here. Just to get an idea about if they're sexually active or not, because there might be some, it might be useful information to know. PMAFTOSA, if you've got time. I mean, it's very difficult, isn't it, to fit PMAFTOSA? If you're going to sacrifice one thing, I would say definitely in here. I would say it's this PMAFTOSA, because this isn't really kind of a in 8 minutes. You don't really have time. You just got to focus on the key themes here. They do like to, smoking is quite important, particularly for transgender patients, because so they do like to screen for smoking, and they do advise transgender patients, if they do intend on taking hormonal therapies in the future, to stop smoking, because it will increase their hypercoagulability and the risk of venous thromboembolism. So they do focus on smoking quite a lot for transgenders, on getting them to quit smoking. Yeah, so definitely ideas, concerns, expectations, that's important, which kind of you can just do throughout the consultation. And then and then Dr. asked very nicely about discrimination. That's an important question. Have they been suffering with any kind of abuse or discrimination? So definitely that's an important question to get in. And like we were talking about in the last session, so transgender is not considered a mental illness, gender dysphoria. So transgender, just for the definition, so transgender itself is the mismatch between your biological sex that you're assigned at birth and your gender identity. That's what a transgender is. But then gender dysphoria is the discomfort or stress as a result of that, and that could be because of the primary or secondary sexual characteristics, or it could just be a more psychosocial aspect, so because of the kind of the gender role in their life. So that's kind of the difference. So gender dysphoria, so discomfort caused by being transgender or having that mismatch, both in terms of the psychosocial aspect, which is your gender role, and the biological aspect, so your sexual characteristics. And that's often what gives rise to that discomfort that they feel. Like they'll start growing breasts or start growing hair, facial hair and things like that. I think two questions that are important to ask is mental health. How are you coping? Because basically, there's very rare that a transgender person doesn't experience mental health problems. They often being transgender often coexists with having mental health problems very, very frequently, anxiety and depression and other stuff. So definitely worth screening for that. And then the other one is, the relationship. Kind of, you want to get an idea about their social life. Are they secluded? It's very common for a lot of these transgender, because a lot of them are very young in age. They kind of spend all of their time online, on the computer. They don't talk to anybody because they have no confidence. They've got poor self-body image and things like that. So they kind of avoid, they have social anxiety, things like that, very common amongst the transgender community. So yeah, so they'll often seclude themselves. So it might be worth getting an idea about the relationships, and that includes, who you've talking to about this. Yeah, day-to-day challenges. So something that you might be worth asking is about toilets, because that seems to be quite a big source of anxiety for transgenders, about like public toilets and things like that. Or this is a 16-year-old, so they'll be going to school. So any discomfort with using the public toilets at school and things like that. Yeah, so that's the three things there: mental health, social life, and discrimination and abuse. Really, three really important questions I think are worth asking. So yeah, they'll probably already, because they've already spoken to the LGBT Foundation, so they're aware of what the diagnosis is. But yeah, definitely they're aware about transgender. Might be worth giving them some information on gender dysphoria and the difference between the two. And then management. So really management here in the GP surgery is just to refer. So if they're below 17, they need to be referred to the Gender Identity Development Service. If they're 17 or over, then they need to be referred to the Gender Dysphoria Clinic. And then, so the Gender Identity Development Service, so that's a big multidisciplinary team, involves various different psychologists, psychiatrists, and psychotherapists, and occupational therapists, so loads of different counselors and things. But it is primarily psychology based, and so they'll make an assessment, and obviously not to forget the gender dysphoria specialist as well. So they'll all make an assessment, and that will be over several months, over many different appointments, and then they will make a decision as to how to go forward. But for the most part, most patients in the GIDS service are just psychological. They don't start any medical treatments. There may be a select few who fits very strict criteria who are referred to the endocrinologist for hormone treatment, and that will include at this stage puberty blockers, so either testosterone blockers or estrogen blockers, in addition to the psychological support. But again, that's for the ones that are the really severe cases, really. For the most part, it's going to be psychological until they are transferred over to the gender dysphoria clinic, and there they'll be kind of a lot more open to medical treatments and surgery, as well as speech and language therapy as well. But obviously, psychological counselling is still a major component as well. So some of the support groups, LGBT, so LGBT.Foundation, which is the one the patient mentioned here, that's a really good one. How we mentioned, because mental health problems so commonly coexist with people who experience gender dysphoria, so depression and suicide risk and all that kind of thing. So it definitely might be worth pointing out Samaritans, somebody for them to talk to, which is open 24 hours a day, either online or on the phone, for anyone that they want to talk to. And then if they've got any kind of been experiencing any abuse, that might be a good one, Gallup charity, to point them towards. If they want some help about how to speak to the family and friends, then this PLAB website is a nice resource for that. And then sometimes these patients can be, say for example, they come from a religious background, or their parents for whatever reason don't accept this transgender lifestyle, then they may end up homeless and be chucked out of the house, and so that might be a useful charity to point them towards as well, if they're having problems with their family. I mean, they're the main ones I've come across. But yeah, there might be some other ones. But yeah, definitely there is support there. Point them towards, do offer them leaflets in these kind of scenarios, especially for these kind of first presentations. Give them, point them towards these different charities and foundations. But yeah, that's the kind of idea. I mean, we're not expected to know about the details about the treatment. That's for the specialist. So the junior doctors and the GP surgeons are not going to be prescribing these hormonal treatments for 16-year-olds. That's just way the realm of what we're expected to do. So yeah, definitely do just refer and offer support, and that's basically the mainstay of how we're expected to manage these kind of patients in a GP surgery.